welcome back to my nutrition talk today, and our topic is maternal and child undernutrition stroke overnutrition. So literally this is maternal and child malnutrition. Maternal and child malnutrition and micronutrient deficiencies affect very many people in the world. These conditions include intrauterine growth restriction, low birth weight or high birth weight, protein energy malnutrition, chronic inadequate or too much energy intake to meet needs of these women, and micronutrient deficiencies plus high doses of these micronutrient supplementations. The rate of stunting or chronic protein energy malnutrition, overweight and or obesity are increasing in Africa. So why I'm addressing these? The 4 common micronutrient deficiencies include those of iron, iodine, vitamin A and zinc. Human development is not possible without taking care to control undernutrition and micronutrient deficiencies as well as overnutrition. Maternal nutrition refers to the nutritional needs of women during pregnancy and after delivery, and sometimes also to the period prior to conception. The woman who enters pregnancy with full nutrient stores, sound eating habits, and a healthy body weight has done enough to ensure an optimal pregnancy. Then, if she eats a variety of nutrient-dense foods during pregnancy, her own and her infant's health will benefit further. Women who are undernourished at the time of conception are unlikely to improve their nutritional status during pregnancy when they have additional demands due to the growing fetus. Maternal undernutrition is persistent and an important contributor to intrauterine fetal growth and poor birth outcomes, including low birth weight, neonatal mortality, and subsequent children malnutrition. Maternal undernutrition, including chronic energy and micronutrient deficiencies, is common among lactating and pregnant women and their non-pregnant counterparts. Women of childbearing age and most pregnant women are anemic, and some suffer from infections like HIV and malaria. Just before I go deep into today's topic, please allow me talk about this as it affects positively our topic today, and it will help you even understand much more how you can prevent these maternal and child undernutrition stroke overnutrition. So I'm going to talk about nutrition prior to pregnancy, as these affects maternal nutrition as well as infant nutrition. A discussion on nutrition prior to pregnancy must be, by its nature, focus mainly on women. A man's nutrition may affect his fertility and possibly the genetic contributions he makes to his child, but nutrition exerts its primary influence through the woman. Her body provides the environment for the growth and development of a new human being. Full nutrient stores before pregnancy are essential both to conception and to healthy infants during pregnancy. In the early weeks of pregnancy, before many women are even aware that they are pregnant, significant developmental changes occur that depend on women's nutrient stores in preparation for a healthy pregnancy. A woman can establish the following habits. Number 1, achieve and maintain a healthy body weight. Both underweight and overweight women and their newborns face increased risk of complications. Number 2 is choose an adequate and balanced diet. Malnutrition reduces fertility and impairs the early development of an infant should a woman become pregnant. Number 3 is be physically active. A woman who wants to be physically active when she is pregnant needs to become physically active beforehand. Number 4 is receive regular medical care. Regular healthcare visits can help ensure a healthy start to pregnancy. Number 5 is avoid harmful influences. Both maternal and paternal ingestion of or exposure to harmful substances such as cigarettes, alcohol, drugs or environmental contaminants can cause miscarriage or abnormalities, alter genes or their expressions, and interfere with fertility. So number 2, I also want to talk about pregnancy weight, and this is because pregnancy weight affects your maternal nutrition as well as the nutrition of the baby you're going to give birth to. So pregnancy weight. Being either underweight or overweight presents medical risks during pregnancy and childbirth. Underweight women are therefore advised to gain weight before becoming pregnant, and overweight women to lose excess weight. An underweight woman has a high risk of having low birth weight infant, especially if she is unable to gain sufficient weight during pregnancy. Compared with the normal weight infants, low birth weight infants are more likely to contract diseases and nearly 40 times more likely to die in the first month of life. Impaired growth and development during pregnancy may have long-term health effects as well. Research suggests that when nutrient supplies fail to meet demands, permanent adaptations take place that may make obesity or chronic disease such as heart disease and hypertension more likely in later life. Other potential problems of low birth weight may include low adult IQ, so educational disadvantages and other brain impairments, and short stature. Not all cases of low birth weight reflect poor nutrition. Heredity, disease conditions, smoking, and drug use, including alcohol use during pregnancy, also contribute. Even with optimal nutrition and health during pregnancy, some women give birth to small infants for unknown reasons, but poor nutrition is a major factor in low birth weight and an unavoidable one. Overweight and obesity. Obese women are also urged to strive for health weights before pregnancy. Infants born to obese women are more likely to be large for gestational age, weighing more than 4 kgs. Problems associated with a high birth weight include increased likelihood of a difficult labor and delivery, birth trauma, and cesarean section. Consequently, these infants have a greater risk of poor health and deaths than infants of normal weight. Infants of obese mothers may also be twice as likely to be born with neurotube defect. Follate's role has been examined, but a more likely explanation seems to be poor glycemic control. Obese women themselves are likely to suffer gestational diabetes, hypertension, and complications during and infections after the birth. So if just you'd like me to talk about obesity, overweight, and glycemic control, you will have to inform me on the comment section, and then I will drop the topic right there for you. Okay, in addition, both overweight and obese women have a greater risk of giving birth to infants with heart defects and other abnormalities. An appropriate goal for the obese woman who wishes to become pregnant is to strive to attain a healthy pregnancy body weight so as to minimize her medical risks and those of her future child. Women must gain weight during pregnancy. Fetal and maternal well-being depend on weight gain. Ideally, a woman will have begun her pregnancy at a healthy weight, but even more importantly, she will gain within the recommended weight range. Weight loss during pregnancy is not recommended. Even obese women are advised to gain between 4.9 to 9 kgs for the best chance of delivering a healthy infant. Current concerns about obesity raise questions as to whether such recommendations are always appropriate. Compared with older mothers, for example, the risk of lifetime weight retention after pregnancy may be far greater for young adolescents. The ideal weight gain pattern for a woman who begins pregnancy at a healthy weight is 1.5 kgs during the first trimester and about 500 grams per week thereafter. And I will talk about prenatal weight gain if you'd want me to talk about it in a different nutrition talk. So let me just continue with the pregnancy weight topic. If a woman gains more than is recommended early in pregnancy, she should not restrict her energy intakes later in order to lose weight. A sudden large weight gain is a danger signal, however, because it may indicate the onset of preeclampsia. Preeclampsia is hypertension in pregnancy, and if you realize this, if you note this, please make sure you see your doctor before you can continue or start any type of medication. The weight the pregnant woman gains is nearly all lean tissue, placenta, uterus, blood milk producing glands, and the fetus itself. The fat she gains is needed later for lactation. Physical activity can help a pregnant woman cope with extra weight. So, I'm going to talk about weight loss after pregnancy in our next talk, and physical activities for pregnancy, and nutrient needs during pregnancy. So please make sure you stay with me until the end of this talk and until the end of this topic. It is going to have very many talks, more than one upload, more than two uploads, more than three uploads. Okay, so just make sure you stay with me until the end of this if you really want to understand about malnutrition in the life cycle and how you can prevent all this. So if you're looking for a nutritionist, and a very good nutritionist at that, who's very friendly, who's loving, who's not judgmental, you have found me. My name is Ruth, and I am going to be your nutritionist, or I am already your nutritionist, because you're taking this nutrition advice and talks from me already. So please make sure to stay with me always. Make sure to look for me if you need a nutritionist who can solve any of your nutritional problems. And trust you me, I'm going to stay there for you until we achieve positive results for me and you. Okay, so I love you. Bye.